Greetings, Belizeans and our population of persons living with disabilities. I am Roxanne Marin, President of BAPDA, the Belize Assembly for Persons with Diverse Abilities. On behalf of our BAPDA family, I would like to express our sincere solidarity with each of you, your family members, supporters, and caregivers, wherever you are, as we are experiencing this COVID-19 pandemic. As your president, I want to assure you that BAPDA is very aware and concerned about people living with disabilities in Belize being at a higher risk of contracting COVID-19. We must be more vigilant in our health awareness and our preparedness practices. The safety and well-being of our Belizeans living with disabilities is BAPDA's priority. It's understandable to have questions about this COVID-19 pandemic, as Belize is still in phase 2 of the 4 stages of COVID-19. I would like to provide some tips to persons with disabilities in our community. Sadly, many of us do not have adequate access to healthcare or community support. Children, elders, and other vulnerable communities are therefore even more exposed at this time. BAPDA's ability to offer support is limited. We are an advocacy and referral agency, yet we will do the best we can. Our phone number and contact is 501-631-0724. Our Facebook and email is bapda.belize@gmail.com, babda.belize@gmail.com. In an effort to safeguard our population against the coronavirus, BAPDA hereby advises the following. Tip 1. Due to the fact that the coronavirus may enter your body by touching your eyes, nose, and mouth, keep your hands and surfaces washed and sanitized. Tip 2. Soap and water is best. Use sanitizer when you cannot access soap. Wash hands inside and out, up to mid-arm, in between fingers and thumbs. Tip 3. While outside, stay protected. Cover nose and mouth and use shades or protective eyewear. When coming from outside, leave clothing in a bag at the door. Wash hands and face before entering your home. Sanitize shoes at the door. While in public spaces, stay 4 feet away from each other. As much as possible, stay indoors, self-quarantine, work from home. Essential, stock up on food and water. Essential, stock up on excess medication. Do not use ibuprofen or Advil. Keep in mind health services will not be consistent and accessible, so prepare wisely. If you rely on caregivers, consider increasing the amount of persons that you depend on in case one gets sick and has to go into isolation. Worst case scenario, be sure your loved one knows of your special medication in case you become unwell. This may be for your insurance, for special medical needs, for dependents, for children and elderly. For health providers, keep on masks and gloves at all times as you are in direct contact of persons. Disinfect as much as possible. Homemade or Lysol spray. Do not bathe with Clorox. Constantly clean off wheelchairs, canes, walkers, transfer boards, or any other product that is handled frequently and used in public spaces. For loved ones that are housed in nursing homes, call, text, WhatsApp, or social media communication with them. Contact the agency to ask about assistance for a person with disability that may not be able to hold a phone or dial a number. The service providers, support staff may be able to assist you to stay in touch with your loved ones. Presently, BAPDA is not offering any support in terms of groceries or medical supplies. Below are contact numbers for agencies that you can seek for further assistance. For emergency services, the Ministry of Health Coronavirus Hotline is 0800-664-2272. In the case that anyone is showing symptoms of COVID-19, go directly to the Cleopatra White Health Center in Belize City. World Health Organization 223-3946 or Google Disability Considerations during the COVID-19 outbreak. All health centers are closed. Unless it is a life and death situation, you will be turned back from any health center or polyclinic. BAPDA's advice is, do not panic. Belize is still in phase 2 of the COVID-19. Do not listen to rumors. Stay tuned to the health updates. Log out of social media if it is causing too much anxiety. BAPDA takes this opportunity to commend the various media houses that has interpreted the COVID-19 information in sign language. This is an impressive inclusion of persons with disabilities. Again, I share with you our organization's utmost solidarity, praying that you and your loved ones remain safe and sound so that we can all overcome this pandemic period in the life of this world. Keeping up the high morale is what we really need in these extremely difficult days. Be considerate of others. Do not come outside unless you must. Together, we can save Belize.